Right. So Frankie's going to say go and then go, right?
Go.
Do 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 do. I'm sorry. Delaney's going to keep me in order.
No.
It's my job to cause havoc. Brad, you're not helping me.
No.
Contamination.
Contaminated. Wow.
Just keep going. Contamination. I'm going to just shame you. And you yes.
Okay.
Outstanding. Very good. Yes, ma'am. I'll hold on to it for you, dear. I'm going to lay it down below here so you guys know, okay? Yeah. Just try to go around. The key is to communicate. If you're going around someone, say behind you. So if you're going that way, just say, let them know you're going through. Just kind of sneak through. Be aware of the field. This is working in the OR, right? It's about trying to go around things and communicating. All right. I like it, but probably don't want to do that too much. It's all right. Then communicate. Can you get this for me, or?
I need I'll be there. Can I go there?
Yeah, sure. Just step through. Just all you gotta say is just I'm right behind you guys, so they know you're behind you. Yeah. It's like working in the kitchen, right? Everyone worked in the kitchen at one time, right? No? Maybe? Behind you. Sweep the floors, please. Pots and pans. Heard. 86 French fries.
86 and French fries are doing something.
Exactly. Very good. I like that. Yeah, they've had burgers and French fries. Walk out.
Oh, that's contaminated, but
Contaminated.
that one's borderline contaminated.
All right.
I already made that comment earlier.
Okay. Three.
Oh, there's so much pictures.
So here's a good question. Do we open up dressings in the beginning or at the end of a case?
End of the case.
All right. And why is that? We don't want to get it dirty or maybe get lost in the count. So I see an ABD there. We probably don't want on your field.
We got this stuff up for
Yes, ma'am.
Now or later, when she's ready.
You can wait. It's probably easier just to hand it to her.
Sharp,
Yeah.
right?
I'm a believer in if it's easier to just, if someone's scrubbing it, just wait. Hey, can you grab that for me? Because sometimes some things are really wonky to get onto the field, right? So ChloraPrep is another thing too, right? Who's going to prep the patient? You or the nurse?
The nurse?
All right, so more likely it's going to be not open to your field.
Put that on the field. Okay.
It's okay. So if you look, here's a good thing. If you look on your preference card, it should say open or not open. So verify what needs to be open. Prep typically is not in dressings are not open, right? What's that? Just leave it right now. Yeah, if something ever goes to your field, just leave it.
It's mainly setting up the mayo, and then putting the drape on, or the whatever.
Yeah, so good question. Haley, put the mayo cover on, but let her put the actual blue towels and stuff on, right?
Okay, good.
Yeah, that was, Frankie asked that. I forgot to tell you that.
I was wondering how
It's okay. We're just pivoting. We're moving. We love it. Patient's coming down with an emergency inguinal hernia. It's incarcerated. It's bleeding.
Got a drape for you, Annie, when you're ready.
5 minutes in.
How long?
5 minutes.
Doing pretty good.
Indicator looks good. The whole thing looks like.
Do not put the towel on, just put the mayo cover on and set up your back table, get ready for a count. And when you're ready for a count, let me know, and then I'll, obviously the other person can get in there.
So hypothetically, if the ring stand was already down as my 3/4 sheet pivot,
Pivot.
all right. So I'll be extra covered today.
Oop. It's okay.
I was wondering why it worked so well.
Yeah, she just said that. Do you have one of these?
No, I just have it's touching the wall.
Yeah, so I'm just gonna, like, in the future, if you want to just grab it with your foot, move it away from the wall, and then go, because obviously you're trying to avoid hitting that back wall. It's okay to use your feet.
Am I taking instruments out of this tray?
Get it up on a stringer and get ready for a count. And then when you're ready for a count, the other person will get in there and set up that mayo. So yeah, if you want to set up like I showed you before, that's fine. But don't take the stringer off, right? That's fine. What I normally do would say, is it okay if I put stuff on your mayo? And then just go ahead and do that. But verify with the tech, typically, yeah. Or they can just grab it from you. You ready for a count?
Almost. I'm ready.
You get your gown ready over there? So I would have it ready, but don't open it. Have it ready, but don't open it.
Whoa! That's not fair. She took my stand, okay.
I need to find another one.
Oh,
You can use this.
oh, okay, great.
Having technical difficulties.
Is that your glove?
Oh, those are the
Doctor's?
doctors.
Okay.
I think I'm ready for it. Can she still be putting things on my finger?
So everything has to be open and then ready for a count.
Okay.
So is everything open? The dressings don't get open now, so we'll wait. Okay, you ready for a count? All right, scrub in. I'm coming behind you there.
You ready for the count? In about 30
Just get a little wet and then come in, I'll tie you in. Okay. Okay, your dressing or your drapes set up in the order you want to do? Or order you're going to drape?
I believe so.
Should be yes or no. You got your 4 blue towels ready? You
Not ready,
we'll get them ready.
10 minutes in.
I touched. I'm gonna need it more.
You touch what?
It fell.
No worries. You got enough or you need another one?
I might need that one. Or eight. I am ready for a count. So,
All right, you can get your gown and I'm coming. I'm coming. Right behind you.
I have a hole in my glove. Do you mind giving me another set of gloves? What size are you? 6.5, please.
Good call. Time.
11.
Thank you. Right, it'd be okay, sorry, I've never had to change before, so I'll essentially just be able to take them out and change them.
That glove is sterile. You're sterile, or is one of your hands not
I
sterile?
have a puncture, I have a hole in
So
my
just do an open glove technique. You're fine. You hear me?
Okay.
Spin. Your partner here can spin with you. You're both sterile. Doesn't really matter. Just spin now. You're fine. Yeah, typically, Haley, you would have 2 gloves on,
Okay.
and you just take that one that is perforated. If they're both, you would have to use an open glove technique at your field.
Can I get that other towel that I needed?
Coming your way. So you set up that mayo, okay? Hey, Frankie,
Yes, sir.
could you see if there's any blue towels wrapped in the back? And if not, can you wrap these up for me? You just show. Don't forget about blue towels on here. You need blue towels, right?
I just ate them.
Yeah, I need blue towels on here too. Then you got to get blue towels to your field. And they're working on it now.
Your preference? Where they at?
Where did I put them?
Okay.
Right there. So get that to their field as soon as you can. They're waiting on it.
Same way we wrap everything up.
Sorry, yeah.
Tape's right over there too on that.
That doesn't work.
What are you doing, dancing? You look like you're hitting each other. What's going on?
behind each other, so how does this work?
So you stand that way, and you just kind of come back to back,
Gotcha.
right? It's either back to back or face to face. I like basketball. I used to play like spin moves. Oh, look at you! You're like dancing, dancing.
This is my specialty, Brennan.
That's right. What, dancing?
Yes, I used to do. That used to be my job.
What, dancing?
Yeah.
I don't know. There's a joke there, but we'll leave it there. What kind of dancing are you talking about?
Dance instructor.
Dance instructor. Well, we want to see some moves later then.
Yeah, be more specific.
I went to Venezuela with my wife, and I all the family's like, "Wow, that gringo dances pretty well." It's like I was having a stroke or something.
Were you?
I don't know. I was just like, yeah, all right, what time?
14 minutes in.
Outstanding job. 14 minutes in. You guys are almost there. That's pretty good. It's impressive. My last group was like 45 minutes, and we even got halfway through here.
Yeah. Not very tight. Sorry.
It's fine. As long as towels,
Need to go?
Mariana's team.
So just put them back here for?
Open it up for them. Yeah. Say some blue towels you asked for.
This is not working. You want me to take it all the
Thank
way
you.
out?
What's that?
You want me to take it all the way out?
Oh, it's on a reel. Yeah, I think to extend it, it's fine. Just leave it on a reel. Yeah, I didn't. We grabbed the reel. That's what it was. A 3.0 reel. Not a big deal.
Sorry.
Okay, I need to just
Brad, I only have one rig.
Don't worry about it. Have what you have. In the real world, if you needed something else, you would ask for it because they have all this stuff peel packed. Okay, but for us to go find it is not going to happen.
I don't have a wheat lander.
That's fine. I'll get 2 Wheatlanders to your field.
we all come in.
Yeah, I promised that earlier and I forgot.
You want to look something?
I would love to.
This is Brad jogging. Can you peel pack these two? One's a Cerebella and one's a Wheatlander, but can you peel pack? Give one to each of them. Peel packs are in that drawer on the left-hand side.
Does it matter what blade?
Start with a 10 blade. I think it looks like a 15 on it, but let's go with 10. Just wait on your Wheatlander, right? You feel uncomfortable?
Am I allowed to look to confirm?
Yeah, of course. Working together.
Yeah. No, I think probably it's helpful.
Wheatlanders are behind you. One's a Cerebella, but we're just treating it like Wheatlanders.
How would I do this actually?
Okay, very good. To this side, open up and let them grab it. Right.
So just
So this side is where you seal it, and this side is where you're open.
perfect.
Right. Other side, over there. Give it to them, Frankie. Frankie, give it to them. Good. Outstanding.
I think we're done.
Are you saying you're done? Because I'll go through it, but I'll stop the time on you. If you don't stop it, just tell me what the time is. Give me your official word. You happy with it? Good? Okay. What's our time?
18 minutes 43
Can you write that down or remember it for me?
I marked it.
Oh, okay. All right, just sit pretty and I'll look at it in a minute, okay? Just yeah, of course.
Brad, I'm having problems, but I can't figure out what that last one is.
Here?
It's
Yeah.
a right angle.
It's a right angle.
Okay. So then I am done then.
Let me look. Official? Done?
I don't have the string though. That's the only thing I don't have.
The what?
So you want me to load a suture? Is that what it is?
Did you grab a tie? That's a tie.
No, I didn't grab a tie, but it wasn't on the paper.
That's a tie right there.
Oh,
Yeah, it's on a reel though.
how'd she have that?
It was part of your count. They are your preference card. It was picked. How did she have it? She picked it.
It wasn't on my preference card.
It's
That's why I was so confused.
no, it's right here. Here, Delaney. Look. Oop. Where is it? Here. 0 ties.
Oh, it says
No worries. Let me know when you're done. And then I'll go through and see if you missed anything. And then obviously time is the important part. You have your case ready? All right, we're gonna just leave it on there a little bit and then lay it on. Yeah, that's fine.
Alright, so then these need to go.
There again.
I'm trying to intimidate you. Is it working?
No, you can intimidate this team. Look at this team.
I'm not intimidating you.
Yeah, whatever.
That was worth a shot.
I already went. We're good.
I don't know. I'm sure.
Catch me a phone case, maybe.
Obviously, they beat you on the time, but let me go through and look at both of the Mayos. Let's
How do we
start.
go about that when like?
This is me like that?
Yeah.
So,
Because obviously everything had to get shifted over because it was I rewrapped it like 3 times.
so I just wanted you to, there's two, I'll look at yours in a minute. There's two things I wanted you guys to do is follow directions. That's important, right? I'm asking you to do something. Preceptor's asking you to do something. You just follow it. Even though you might have like, why are we doing this, right? It's okay to ask questions after the case. If you're asking my opinion, obviously they like to train you having this stuff on your Mayo. I try to get this as organized as I can. I wouldn't drop it to the floor like that, but beforehand I would try to get this as wrapped up tightly as you can. And the problem is this has been used so many times it has a lot of memory to it, right? Now, I personally wouldn't have it up here. I would have it in my ring stand, in my basin. But a lot of people train you out there in the preceptors. They want to have this on your field. So in reality, you can probably have this at the very end after you set up. If that's your question, how do you do this? But see how they say it has so much memory, it's just going to like, that drives me nuts. So I'm okay with you. In this case, you followed direction. That was perfect, right? But this would drive me nuts. I would put it in my basin. This I would have ready to go. This is perfect. I would have both of those in my basin. As I'm coming up, all my stuff and my past stuff is going to be in my basin. Setting up here, we're looking at 15 blade. We won't do a 10 blade. That's fine. We have some rakes. Yeah, that's fine. It's fine. It's fine.
Just like it wasn't there, so
No, you did fine. You did great. So you have 2 sends? Yes. You have a Adson with teeth. You have a rat tooth.
I couldn't figure out what that one was.
Yeah, we have a DeBakey rat tooth and an Adson with teeth. We have a Metzenbaum scissors. Negative Ghost Rider. We have a straight Mayo. So we have some Kellys, 2 Schnitz. We have some Untying a Passer, Right Angle, Army Navy, Richardson, and we have some Wheatlanders. That's perfect. Really, I'm just trying. This is not written in stone the way it is. I just wanted to see if you can follow directions on that. Now let's look at hers and see if you can compare. What do you think? Delaney, come on over. No, she had a nice little yank hour that's not so chaotic. Did she have a right angle? Did she have something on tying a passer? Would you put this on, what is this? Is this a needle driver or is this a Schnitt?
Yeah.
So you typically want to load a tie either on, could be a tonsil clamp, a right angle. In this case, they're probably going with the Schnitz. Do we have any tonsil clamps on here? So we're missing you don't have any in your thing. It's okay, that's not your fault then. We have some hemostats, Metzenbaum, DeBakey, rat tooth, Adson with teeth, 10 blade, 2 prongs or Volkmans, 2 sends, and you got your retractors. It's perfect. The only thing you're missing is the Schnitz, but that's not your fault. Now,
These are supposed to be combos.
these are cokers.
Those are coconut. I thought they
Yeah, these are cokers. The cokers are fine. But the Schnitt is supposed to be on a tie, right? Not on but this is fine. Not on a needle driver, right? So time-wise, I think you guys stay in place. If you guys are hot, you guys can break. But you guys have to quickly turn over. Guys, are you guys going to help them turn over? And you guys are going to get ready and get in there. Whoever can beat the time, I'll use it to get to the field and we can actually practice that England order. Yeah, just leave it. I'm using, as of now, I'm using yours. Now, just kind of correct the little things I'm seeing here. Right. So I'm just looking at this, right? Try to organize as you go, right? You have a lot of blades in here. You get your things loaded up. Okay. Pen rows I typically will have in my saline. Have that ready. I would probably have it just like this so it's a little bit organized. This is ready for your, just get used to taking these out real quick.
Okay.
This shouldn't even be open, I'm taking it. I would have these ready to go in case we need local, right? Maybe we're gonna get some other version, maybe. You can have that preloaded, just kind of like, I wouldn't have it on your theme. That's fine right now, because that's not gonna be until the very end of the case. But you wanna have them preloaded, that's fine, just have them clamped down and ready to go, right?
The instrument that's supposed to, this is supposed to be loaded on the snitch, you
Schnit.
said?
Yeah, I don't see a Schnitt here. I don't see a tonsil clamp. Yeah, I don't see one. You have one. Now, I'm looking at this. I mean, is this how you would do it, or is it going to be on a stringer or on a roll?
It's gonna be on
My roll failed.
A roll phone. Yeah. So now you have time to correct it because
Yeah.
you know, okay, it failed. You just can't go with the flow of life. Make a good roll and put that on and organize. Right now, you have time.
Wait, hold up. I gotta do it.
Hold up. Wait a minute. Everyone, put some booty in it. So the time to beat was 18 minutes.
43 seconds.
Someone want to. Oh, I guess I could.
Yeah, it's just you guys by yourself. So
Ready?
18 minutes is the time to beat. So
Ready? Go.
you guys want to take a break, you guys are fine, and then you just hang out for a minute. But eventually, when we do finish, we'll all get back in there together and practice. We'll rotate. What do you think you did wrong? Anything?
Everything.
Everything? Nah, it's not everything. I think you did fine. Nice. Did you do anything wrong right there? Hey, Frankie.
Yeah.
Be careful when you're. I'm just going to show you what you did.
What do I do?
You tell me if it was wrong.
Okay.
I opened it up like this
Oh,
and went like that.
over the table.
Yeah, so open it up, back out, and then come around, right? So, I mean, Jasara did it the other day. It's like she just kind of swept along her table. How far do we need to be away from the table?
Foot.
Right, use it. Foot. 12 feet, right out the door.
Okay.
Now we can get that water from here.
Looks nice. Do you like that little technique there? Yeah. It feels more in control, doesn't it? Yeah. Took me a while to figure that out. I spent most of my time trying to make the stringer look nice, and it's just a waste of time. That towel clamp helps out.
My favorite thing that you've shown us so far is to see what the retractors and forceps. For the putting them up like this.
Right.
That makes it so much easier.
15 minutes. I'm just joking. Delaney's watching. We're at 2 minutes. I have a gift card for $75.
I didn't know that was in the running. I would've
No,
gone
I don't have it in mine. I can't afford that. Got a patient coming down. We got to get in there quick. Get a count going.
Or from here.
You excited for your wedding? Nervous? Where are you having it? Up north? How many people?
Probably roughly 200.
Wow. You got your speech ready?
We got some competition. Yeah, I would look at it. Can't do it.
Okay, good.
You're doing okay. You did a good job.
I'm gonna start putting stuff in my basket.
5 minutes.
Good job.
Yeah, awesome. Guys, I know we're just pretending, just be aware if you're standing like that, just stand, not up with your back to the table, all right? Either, yeah, there you go. Learn to stand more of an angle that way. Okay, there you go, perfect.
So if I'm not doing the nail, then I'm just pretty much leaving everything up here.
Just get the stringer on there and get ready for a count. Have the drapes set up in the order you're going to use it.
Okay.
And then when you're ready for a count, then we'll get in. Natalie will scrub in. So Natalie, I'm just going to say, when Frankie's here and you're over here like literally like this, I mean, it's just, you shouldn't be hanging over. So here's an easy, Frankie, can you just grab this
Yes.
for me? I'm just saying, yeah. So again, don't open up dressings until the end. It's easy to ask for the person that's scrubbed in to grab something. Then you try to go around them as they're working and flip it onto the back table. You can see that's more problematic for contamination, right? And I didn't mention it, but something happened with this recorder sheet. Can you explain it to me?
Yes.
Alright.
I'm not allowed to put it back up.
I hear you. So you're just gonna roll with it. So here's the deal: when it's like this, just get another blue towel and just lay it in the back, and just so you have some protection. I hear you. No worries.
It's sterile. It's not for.
No, I hear you. I'm just very. To me, it bothers my. I'm very anal retentive. That bothers me. Okay, good. I would literally throw it off. I would literally throw it off and put it on the floor and get another.
For timing purposes.
No, I hear you. No judgment. Just observations. There'll be plenty of time for judgment. You guys got this. You guys are way advanced than the average bear. Actually, it's really impressive what you guys do. I've had classes that didn't know what was up or down. And it's just, Chrissy's a testament to her showing you everything. Yeah.
But you gotta be a careful home, no? Thank you.
And I just gotta get your placement set. You guys be happy with that. I'm trying my darndest.
the inside of it.
Good. Call yourself out. You would have to get a new one. Let's just keep rolling with it. No one's going to be upset if you call yourself out. Be upset if you don't, really.
So I don't open this one?
So dressings are open up at the end, and so dressings are.
To open it.
It did. Yeah. So if let me see if I'm wrong, because then I will stand corrected.
Just to
I
open
just
it.
slid off just so you know,
Yeah, it's my fault. Should say it's not open.
The other one that's gonna open? Yeah, the other one says open, but is it dry?
New pen is coming.
Okay.
It's my fault. Not yours, telling. But you know now, dressings should never be open
Did you?
again. Okay. You guys follow directions. That's true. What's that?
I need to go back.
I'll do it. Frankie, not that it matters, but that's
Oh, good point. True that.
Patient is now bleeding. He's having issues in preoperative. He needs to get in here. Got a hematoma. Hematoma. Snototoma.
This is really good stuff.
It's short point. It's not short. Yeah, Penrose would not be in peel packs. Do you know they sterilize a bobby pin? Used to be for like OB, they would sterilize a pin. I don't know what they use it for. Ask Chrissy about that.
I want to see the spoon.
That's for DNC. That's always fun, right? It's like a soup spoon is scraping out the.
That's actually what I saw when we went to short quick.
Yeah, so I hated that case. Endocervical or. They just give me the spoon. It's just kind of they just scrape out, put on top of.
She brought the bacteria right up there.
Right.
Was just like,
Someone probably had soup at one time with that. You ready for a count?
10 minutes.
18 minutes. Who's going to be the winner? Chicken dinner.
today. You make first, you're last.
So I'm ready for a count.
No, that's me.
Are you ready for a count? Looking good, Frankie. Impressive. Towel rolls are like need a little work on everyone. They're a little limp.
I'm ready for a count.
All right, go. You can just sit pretty.
Okay.
And
Can I adjust my glasses?
I can.
Thank you.
So there are things you can get where it hooks onto here and has a little drawstring. Or yeah, we'll keep this tight.
Oh, I like that.
Yeah, I use them for my glasses because nothing like me sitting like this.
Yeah, I can't stand
I have it in my office. You can buy them on Amazon. They just go right on the end of them, and they can just kind of tighten them up, and they just won't move at all. Yeah, because
Okay.
I hated cases where halfway through I'm like this.
Yeah.
I really need new gloves. New gloves coming. She doesn't really need them.
I'm just saying.
She said it.
Contaminated. Good. Heard.
My office.
Bad. What's wrong?
I don't think there is, but I'm just asking. So it's the gown, the gloves, the 3/4, the towels, and the last.
You had it perfect. I would only say also maybe just to save time, just have these opened up, right? Yeah. Little things, right? Just save time. Open them up.
So if I got,
What happened?
so if I got the blue thing, what does that count as contaminated?
What blue thing? There's a lot of blue things there.
You can see the rat mark.
Yeah. So when in doubt, there will be strike through. When in doubt, you just have to get it over again, right? So try to eliminate your dripping. No, I appreciate it. I'm just saying in the real world, if someone says you contaminated, you just got to start over. Right.
I have like this. I don't do that, do I?
I do. But you can help her turn.
Okay.
She just did.
What time? Time check?
12 minutes and 12 seconds.
Patient is now rolling down the hallway.
Well,
Nope. Coming your way. Don't say it. I know what you're thinking. I had Jasari saying, well, screw this. I'm thinking of a new career. That's what she told me.
She said that?
Like all stressed out. Like,
That would be her.
I was like, that's a fight or flight. You either want to run out the door or you're just going to go through the flames. Jump in the flames. I'm calling Natasha. Natalie, I'm sorry. Natasha was in last class. Small, petite.
I think I know who you're talking about.
Yeah. She works at Fawcett now. She was very shy, but I couldn't get her to stop talking at the end.
How was Sarah? Was she shy?
Sarah was,
She's a hot mess. I love her.
yeah, but she's such a nice girl. And she's worked at Lakewood Ranch.
Yeah.
I felt like I was, not give her and Taylor. Just, they were so, attached to Carolyn, and
Yeah.
it was kind of hard to follow that lead.
Yeah.
But I did my best.
She got like $8 an hour. Pretty good.
No doubt, they both deserved it. They both were dedicated. They both were there studying on their own, and they went through a lot of externships, and just like you guys both. So it takes a lot, right? You have to put in the work. There's some trials. It's worth it at the end, but there's no easy way to get to it.
Yeah, I asked her how she was doing. I haven't talked to her a couple weeks. I'll probably bring it up again. I asked her how she was doing,
Yeah.
her first week out. She's
Well,
like, I don't know.
I requested at their side to get a student there, so I want because you have a lot of students. So
I mean, if that's an option.
Yeah, I thought about that. You guys can kind of connect. You feel comfortable, but they haven't reached. None of them reached out to me yet, so I'm a little concerned about.
Ranch is really close to.
You have a lot of options, manatee plate or
Yeah.
Maybe
Time check.
14:15.
Surgeon almost tripped.
Did someone's water break? That was-
That was my nervous tinkle.
Someone's incontinent. Delaney, can you go get a Foley for me, please? Have you guys put Foleys in?
Yes.
Some no, some yes.
Where are they?
I'm just joking. Yeah. You serious? No, I was just joking. There's water on the floor. You want to put a Foley in? I bet you. Time.
14:53.
Oh my gosh.
Oh my God, is she gonna do it?
I'm sure she won't do it.
15 minutes. Stop.
You have no idea how much sweat is coming through my neck right now. I cannot.
4 seconds.
I'm just gonna go home.
So what we'll probably do is we'll stop, take a break, come back, and then everyone will use whatever team is to start that case. We'll gown in, drape the patient. We'll go through our hernia, but we'll give you a little minute to take a break.
The second one.
Oh, that does look like fucking medicine, or it looks like open. Thank you.
So to use your terms, does that still count?
My turn.
Focus on your guys' thing. You got it.
What's that mean? Meaning my the fettuccetto, the profundant, Bailey's, atrium. We didn't go over. Don't worry. There's a couple things on there just extra. Satinsky, Javed.
It's a funny Duval.
Yeah.
Duval.
So that's a Satinsky. Yeah. All right. We're studying. That's later. You guys ready? Are you done? 19 minutes.
Uh-uh.
I'm
No.
just-
2 minutes.
I can't do it. I don't know what that thing is.
what does that mean?
I don't know what that instrument is on there.
Okay.
You can't ask us.
I'm thinking out loud. Okay.
It's fine. I like that. I like her. She's getting aggressive. I like that. Which one? Which one?
The
One that looks like a coker.
Yeah, the one that looks like a coker.
Right here?
Yes.
Coker.
Okay, it is coker.
There's no. It's not on the list.
Okay, my dear. Sometimes life doesn't go where you want it. You pivot, move.
16:50.
A minute and a half.
This is just enough. This looks horrible.
It's not my table. It's yours.
You're doing great.
Can I go in there and change it?
Can you go in there and change it?
No. Would you like me to scrub in and change it?
Yes.
No.
No.
The answer is no. It's mine.
Am I allowed to adjust things?
No.
She's in charge of the mayo. That's not fair.
I think it's fine now. Literally 1 minute.
I actually might need that.
We're gonna
I'm kidding.
you guys can break now because we're going to come back.
I'm practicing.
Good. I like it. Good response. You just contaminated. I'm sure. Yeah. Minus 2 points. That was a test. You failed. No, just go ahead and break because we are going to take a quick break and then come back so everyone can cool down a little bit. Are you calling it or am I on your way?
I'm done.
Time?
17:51.
Wow. Let me see how.
Let's make sure
Let,
they're right.
yeah, let's go. Let's compare mayos. We're contaminated. We're
It
stopping.
looks messy.
So we got
Whose phone is this?
right. Do we have any rakes? Yes. Two Sins, Atson. Yeah, it's perfect, right? We have Rat Tooth, Metzen bombs, hemostats, cokers, right angles, schnitz, vitae. You don't have a schnitz because you didn't have one. So you guys are actually right on. It's just the time was 1 minute, so we're going with this table.
Good
Sorry.
job, guys. All of you. It's a good screenshot today.
Now looking at this,
Okay,
it's beautiful. Frankie did a good job.
Yeah.
This would go into some saline.
Okay.
Okay, I was wondering about that.
I'm a little.
So you want this lubricated and wet. So we're use this as we're going to do that hernia. We use this to retract that spermatic cord and vas deferens. Good. We're going to go with your table. Good job, guys. It was perfect. So take a quick break. We'll come back. We have two options. Either we can all scrub in, or we can just go to the field and go through it in service of the case. We'll drape it together. I probably want everyone to gown in again, so we kind of rotate. Why not? Here's another thing. Chrissy is really adamant about if you're grabbing gowns, if you take them out of a box, we got to restock. And don't leave an empty box there.
I do that every single time because
I know. I'm just saying. I got it from Chrissy. She's right. We should be used to organizing. Even out in the field, if it's a box, we got to restock it. We throw the box away, right?
As a previous bartender.
I know. Yeah. I was just as notorious for grabbing the can off the shelf and leaving the box.
That was
myself.
not me.
All right, let's go use the bathroom.
Oh, sorry.
I need a Mountain Dew. Is what I need.
Both of these up.
Yeah, we're gonna leave it there. We're gonna use Frankie's setup to drape though. No swearing, okay?
I don't swear.
You swear?
I don't swear. You're so ridiculous.
Where's my class? I forgot my name.
I gotta get all down and gloves and stuff again.
Please.
Yeah, because you're for technology purposes.
Yeah. I get coffee if I don't.
This is gonna be hard to.
Tape it.
That's good. You're smart.
I can be smart sometimes.
You're gonna be a general someday. Come! Why do you put that weapon together so fast? You're gonna be a general someday. Just jump in that hole. You ever see Forrest Gump?
Yes.
Okay. We're making Forrest Gump 2. Go at the right angle. Smart. You're a smart cookie.
I want to say it, but I won't.
They're filming. Keep it G-rated. You intubated? CPR? Start compressions? That's you just compressed the head.
His whole body went into that.
Do it again.
Let's go.
Ow!
I've never done it.
I'm not doing CPR down here.
Yeah, I never.
Stay up here.
The bait. What happens? It's the baby. All right, let's get serious.
Yes, sir.
Where are my? Come over here, Natalie, please. And thank you. I'm waiting on Frankie. No, I don't want you. We'll do it later.
What are you doing?
Are you going to be a patient?
Hurry up, get down. Hurry up.
You guys did a good job.
She said woman. You are a woman.
What is that class?
What's that? CPR? Week 7.
Oh, we do
I'll
have
be
to
here.
figure out. I'm so excited.
Oh yeah. Well, if you're not, I'll change it to the following week.
No, I'm going with 9.
That's right.
And I know that's when procedures LIRs do. I think skills is 10, something like that.
I had to do one when
I think I've heard that one. Maybe.
Oh, did
Maybe
you?
I'm not. So then you guys might just have to do it without
Yeah.
me. Like, watch the
I have to
video.
change a lot for you, you know that?
Just watch the video without me. I'm fine.
Oh, no. You mean, okay. That.
For skills.
Yeah.
Because I'll be here to do it.
Your
but
wedding's
then
more important.
when you guys watch the video, just watch it without me.
You just want to know how
You already
work.
have it?
What? The BLS?
Is that what it's called?
Yeah, the
Yeah,
CPR.
I do.
But you-
Well, actually, mine's technically covered, so.
Well, if you have one from that's not expired, it's okay. But it's part of the class. You know, if you're here, you just do it and it just redoes it, or the expiration gets renewed. So,
I think mine's expired.
Until it expired.
2 years.
I think mine
I think mine's
expired
expired.
this July.
So yeah, we just redo it again. So you guys are going to drape the patient. Let's get serious. Put on our game face. Game face. So I want you guys to work together. Drape the patient. Start with the down sheet. That is the operative site. My little bulge. Don't say it. Lights on. Cameras. This is serious. Okay? And obviously the operative or the prep site is right at the end there. Just kind of use that as, yeah. So you're going to go lengthwise. So,
Oh, yeah.
so Frankie, go to the feet and just kind of go down.
Just kind of
Be aware of your field. Yep. There you go. That's fine. Perfect.
Oh, I was trying to
Well,
help you. Sorry.
What happened?
I forgot to put my glasses on. But I was
No worries.
Oh.
Just stab her.
Wait, can I
Sorry.
be down?
Just 1 second.
Yeah, just tell me. Sorry. I didn't
All right.
say.
So the question is, hold on. The question is, can you move the drape down a little bit?
No.
Typically, you don't want to move the drape, but you can move it down a little bit. But you can't move it.
Can't go back
All
up,
right.
right?
So move it down a little bit. That's fine. But that's fine. Now 4 blue towels. Guys, work together.
I'm gonna do that to the bowl like that.
Very carefully.
I should have put it.
Good. That's perfect. Yeah. Be aware of your back. Yeah. Very good.
Is that too close?
Yeah, it's beautiful. Good job. Doing great. Like you're an expert. It's fine. You're just trying to get a window. That's fine. Just lay it down. Yeah. That's perfect. What next? This guy's got, looks like he's got a goiter. So let's,
Take these off or
yeah,
leave
so
them?
doctor, would you like the stickies off? And he says yes. In this case, yeah. Just verify. Or verify with the preceptors. Just never assume anything when you're a student. And that kind of contradicts you guys anticipating, but it's better. Is that facing the right way?
Yep.
Okay, just making sure. I'll apply your anesthesia for you. Where's my coffee? And just be aware that thing's not attached too well. So sometimes if this is in your way, just say, can you move that back a little bit?
Move that back a little bit.
I'm trying my best. Be there in 2 seconds. Again, if this is in your way, just be careful. Got it. So I'm being very quiet and strange standing here looking at the wall because what do we need to do now?
No.
What's that?
No.
Bring all your stuff up. Yeah.
So good. So your instinct is if you're draped, you're setting the table up, right? Get that mayo off, you start passing things off. You should be doing something. Or rather someone say, hey, why are you doing that then? Why are you just standing there? You know. So your job is just to get comfortable, bring it over to the field, bring your table up, become comfortable with the field. And Natalie, you're supposed to just get some light handles on and start passing off bovies, passing off suction, and anything like that. As she pulls a muscle,
Yeah, I almost did.
I'll knock my camera over. Let me try. Okay.
Suction.
I got you.
Yeah.
Oh, I thought Brad was thinking that.
I was, but
Listen, let's be on here though. What? It wasn't on, it was the camera on the thing. But where's the suction?
don't worry, just drop it. We don't have this suction way over there.
I was like, this is the camera.
Yeah, that's the tower, but
Alright.
it's not. You're pretending. All I care about is, Natalie, do you have enough slack? And then tie it down, right? When I say slack, I'm talking, you know, exactly, can you reach the field? Very good. And the same thing with the bovie. And I'll come back there and talk to you a little bit about that, Frankie, in a minute. But
Okay.
the key is, are you comfortable reaching everything to where it's at?
Not really.
Okay. All right.
I can adjust it.
Of course. I'm just trying to see. Now there's a table that, now I'm trying to figure out why you brought everything to that side.
I'm not.
So you're already here. You should have just brought the Mayo here and your table right here,
Okay.
right? Because
Yeah.
then you can start work. But since you had stuff over there, you have to go with what you have available. So I'll probably just reverse it, come back over here. And it's a little bit more comfortable.
I don't know.
It's only $900.
So then this would go save over here too, though?
So you're done with this. This is going to go on the very end of your table over here.
Okay.
And your Mayo can go along the bottom. Then you can bring your table up on the side. Because I'm going to be working here, or on this side, and my assistant is going to be on that side. So the key is, Frankie, is just get comfortable. Now, can you reach this?
Yes.
Maybe I'll get that a little higher for you.
Okay.
Yeah, just be comfortable with it, right? Obviously, we don't have, this patient has no legs. What happened? Yeah. And so just get comfortable with it. Can you reach everything, right? Everything on here, you know, and you know what everything is, right?
Yes.
Yeah.
Everything good? Do you have a doctor's gown and glove?
I do.
All right, I'm going to come in a minute. Do you like this? Exposed. All right. I'm here.
Hello, Doctor. I'm here. Frankie, I'm your surg tech student today.
Nice to meet you.
I'm you, Frankie.
Right.
Love you, Frankie. Thank you.
Did you just moan at me? Moan. Please.
Sorry, but after that first comment, you just like type of please. I'm like, it's just.
50 Shades of Anatomy. So try to get that centered there. Just a little easier. Good one. Good. Come on now. So your thumbs how they're right here. Either you're gonna be all the way under, like one of those games you used to do,
Oh, yeah.
and kind of come out. Right. Perfect. That's. Is this the right hand or left? Left.
Left.
So it goes my right. Always start with the right, unless they verify. Right. So that's very good. Make sure your thumbs are not there. Right. They need to be underneath as you're opening up. Get those numbers
This way
set
or centered towards me?
right towards me.
Towards you.
Towards me, because that's where the thumb's going to line up. If you see the doctor go like this, that means you're not lined up.
Not good.
So doctor's going to come in just like that, right? That was perfect. It needs to be quick. Ba ba ba.
Up, 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 up.
Open. Okay. Time out, please. This is Jim Bob Cooter. We have a right inguinal hernia. He has 2 grands of Ansep. He's not allergic to anything. We gave antibiotics 1 hour and pre-op. Does everyone know each other? Was the site marked for the right side? It was. I saw the initials. Any concerns? What kind of local do we have? Marcaine.
Marcaine with Epi.
So make sure you have, let them know, it's Marcaine, 1% with no epi, right?
With no Epi.
Whatever we wrote down,
Okay.
right? Yeah. All right, we're going to go with this, okay? And then eventually everyone can kind of go through routines of it. Are you comfortable with what's up here? So wherever this starts, so in reality, you know, you'd probably bring that
Yeah.
here closer to the field, and that's fine.
Mariana has a question.
Yes.
Oh, so, do we put 2 Ratex, like, on each side, like how we did with the other case, or?
That's fine. That's a good point. I would start off with some laps, probably for an open incision like that.
Oh,
Now, a lot of doctors probably want to have 2 laps. If doctors want Ratex, do Ratex.
okay.
Very good point. It is preference. So I know a lot of my doctors will just have them out here for the assist. What they're going to do is, if there's small bleeds, they'll go along. We're going to make that mean incision first. Very good point. Local?
Well, you don't need to mark it?
Yeah. if they ask for it. Injection. Ten blade. Adds in with teeth. 2 of them. So go on the opposite side. Incision. So Frankie, tell me the Frankie, tell me the Hasselbeck triangle. What's it about?
Like what? I don't understand your question. Like, what are the regions of it?
So there's triangles 3. Tell me the 3 anatomy points of the Hasselbeck triangle. It's okay.
Inguinal ligament.
Good.
I'm drawing.
No worries. Correct answer is doctor. I don't know, but I'll find out for you.
Okay.
Don't. So the thing is, I like to see if you can think and still work.
Gotcha.
It's a lot of pressure,
It
but
is, yeah.
if you can multitask, if you don't know the answer, don't be ashamed. Say, doctor, I'm not sure. I'm going to find out for you.
Okay.
Instead of just like, and then someone in the crowd like looking at you. Not a big deal. We're going to go. Can I get a Wheatlander, please?
I don't know.
So it's how they're being used. Obviously, this is a cerebella. So if you were asking for it, if your hand was out, I would try to give it to you how you're going to use it. So if I'm going to use it for up here, obviously we can give it that way. If I was going to go down below, try to give it to that. So you can just, the whole idea of giving something to the doctor is just a continual motion of how the doctor's going to use it. So if he's coming in this way, and the answer to the question was like, which way is he going, right? It's a guess. So I'm going to go from the bottom, so try to give it to me like I'm going to use it that way. Yep. Yep. Can I steal yours over there? This is always on your field. Can I get the other one? That was perfect, see? Can I get an Army Navy? Broke. This is why we don't have nice things. Okay. That up like that. Can I get a medicine bomb?
I'm drawing such a blank right now.
Good. Take a deep breath. You got this. Passing is about dangling, right?
Right.
I'm just going to do it. We're kind of an in-service, but so if you have your hand out, you're asking for it, your right hand. So ask for something, right? You want to come in, just kind of you're dangling that in, right? I know this is an awkward angle, but I'm just going to go like this. So the doctor is asking for it. Right? You want to have that kind
And
of
it doesn't
action.
matter if I'm a lefty rather than a righty.
Are
Right?
you-
I can still, I'm left-handed.
You're left-handed, so it's a little awkward for you. Can you pass with your right? Yeah, you're gonna have to learn how to do that.
Okay.
Medicine ball. Nice. Can I have a hemostat? Yep. So when I start throwing stuff on the floor, or on the, not the floor, on the bottom, you just start putting it back exactly where it's going to go. Okay. Do we have any ties available? We have no ties. We just have this stringer thing. Can somebody grab me those ties that we pre-did on that? Right to your left there. It's in the blue towel. There you go. Just grab that. I think we used it the other day. So typically I would do, if you ever had ties, you can have them on that. But I would have them where they're conveniently to be reached. So if you need a tie, free tie, a tie and a passer, you can probably put one of those on. Take one of those out, put them on a passer for me. Get rid of that one. That's
Get rid of
a
this?
ring. Yeah, it's hard to use. So take one of these out, put
Okay.
that on a passer for me. Okay. Just one. There you go. Beautiful. So just lay that down. Can I get a right angle? Good. Nice. Perfect. Can I get a debaki? Or the tie and a passer, I mean? Okay. Reload that passer up. You're going to need scissors soon. So you start anticipating. If you're tying something off, make sure you have scissors ready. If they're tying something, you know scissors are coming down the line, right? And what type of scissors? That's straight mayos, right?
That's it.
Scissors, please. Scissors that work. Can I have a right angle? We're going to do that one more time. Tying a passer.
That was my fault. Apologies. Sorry.
That's a good point. Never pull on something. You literally pull. That was a vessel. You pulled
Right.
the vessel. I've done that before. It's a bad feeling. You tear the whole graft.
It's okay.
Frankie, I love it. Don't worry about the stress. You got this. This is just me right now. Just Brad. This is all I'm trying to do is just get used to some type of stress. Scissors. And just keep it organized. Keep it simple. That's fine. So if I'm cutting something, you should have the what type of scissors, right?
Oh, straight line.
Yes, ma'am.
So in that case, I wouldn't leave that on my.
So if it's something that is, if you didn't start off with on the mayo and you think he's going to use it, just now make
Go
a home,
ahead.
make a home for it, right? And if he's tying off things, typically. So anytime he asks for something, I just add it to my mayo. If an hour goes by and it's not being used, I'll probably put it in the back table. Okay. Can I have a Atson with teeth? Actually, let me get a rake, please. Let me get 2 rakes. Hold that. Like that. Can I have a 10 blade? I'll take that 15.
Where did my 10 go?
It's up top. So you need to keep track of that. It's right there. You have a suture ready? 3-0, bike roll. Blade down.
The Vico's on there. I think you just grabbed the wrong. Yeah, that's Vico.
So loading this up, take your time, get a needle driver. If they want a suture, it's already there. Just say if they need a suture. Okay. That's fine. It's kind of a small one, but is there a bigger one than that? This is fine. I'll take this.
So right here.
So when you see this, just kind of come right in. It's already at the proper area, right? Take it. If you want to organize a little bit more, take that out of this thing. Put this in your basket or your bag, but if not, just make sure you don't get rid of those because they can be part of a count.
Okay.
And get ready to pass, right? It's going to come to my chest. Suture. Okay, good. Good. Give that to the assist. Or just lay it down here right now. I'm going to take that one off.
Right now?
Yep. Take scissors. You're going to have to cut with one hand. Is that your right hand or your left?
Left.
Can you cut with your left or no?
I'll try.
Okay. So what you do is you do it like this. Come in just like this. Scissors sucks. So if you're doing with your left, just come in like that. You got like that?
Yeah.
Try your best. I'm going to throw this suture down. You're going to load it up. Once they're done. Cut out the knot. This is so dull. Alright, throw that Metzenbaum. Do the same thing with the Metzenbaum scrubber. Use Yeah, this is just bad scissors. Load that up again. Maybe one more time. Suture, please. On a needle driver. Slow down. Breathe. You're doing fine, Frankie. A lot. So, remember that. It's been good. Here's what I used to practice. You guys all can practice this there, right? When they say reload this up, so I want you guys to practice, drop it, right? Put this right at your chest to stabilize it. This needs to always be facing up. If this is going to go to the left, that means it's right-handed. If this is going to the right, he's left-handed. So practice this a whole bunch of times. Just put it to your chest, quickly load it, go like that, and just keep practicing that motion. So drop it, right? Pick it up real quick, right? Put it in your hand, stabilize yourself, come in here, go like that. It's good because I know you're going to be nervous, you're going to be like this, but if you ever give the suture like this to the doctor, it needs to be how they're going to be using it, right? You're doing fine, Frankie. I need to put you on the spot.
No, you're fine.
Load that up. So go to your chest, or pick that, put it in your hand, right? Put this to your chest. Good. So this needs to be the needle facing up. Good. Come in, clamp on it, turn. That was perfect, Frankie. That was good. And then maybe the doctor might redo it a little bit, and that's just practice. But the technique was perfect, right? Add some teeth down here. Eventually, okay. What else we need?
Scissors.
Good. So those are things you should just go hand in hand, right? You should know that. At least be ready. Give it to the assist. We're going to try this one more time with the crappy scissors. Cut that. Yep. Wow, these are all terrible. That's a bomb. Curved mayo. Something that cuts. Curved mayo. No, curved mayo is the one. So tie on a free tie. Debaki. Free tie. Debaki. Free tie. Free tie.
Black tie.
So when I say free tie, no worries, no worries.
Yep.
Sutures down, be careful. Right here.
Just pass it. You don't have to put it on.
Give me a tie, please. So this is, have you ever done this before?
Oh, yeah, you pull it tight, right?
Yeah, and I just go like that, right?
Okay.
Yep. Add some with our right angle. One more time, we're going to switch up. Curved mayo. We know it's the straight mayo, right? Because we're not, just don't cut. Cut that, leave the tail.
Not too long.
It's fine. Maybe that's perfect actually. But the only thing when you cut sometimes, don't go in like all the way. Just open up a little bit,
Okay.
the tips, and then turn, right? The reason if you go in too far, you can actually cut the skin on the other side. Right. And so we're done with that suture. Put it in your suture box. Penrose drain. Can I get the Penrose drain, please? So
Any particular way that I
yeah,
hand
so
that?
just pass that. It should be in saline all the time. So pass that with a little hemostat clip to it.
Okay.
And I'll need a debaki too. Okay, good. Debaki. Good. Yeah, I got it already. Never mind. Who else wants to try? You can break. Yeah. Frankie did good. So it really is just about adding strength, pressure,
Yeah, no, I'm glad.
organization. Keep it simple. Is this accurate to a surgery? About 70% accurate. The whole idea is just to get anticipate what you have on this mayo. Nah, unless you want to scrub in. I think right now I just want to see you through the motions because I'm pretty sure it's hot in here. Are you hot? Okay, good. And then what I was saying, Frankie, is the way this starts, keep it organized. If you get confused, right, the doctor says, I need something. Say, doctor, coming your way. Just don't sit there and like,
Gotcha.
because you're not going to have, you know, Celeste or anyone's. But that being said, Frankie, if I was with you out in the field and like you're in your, I'd be like, right. A good preceptor is going to let you think for a minute and say, all right.
Okay.
Or a really good preceptor will let you think, what's the next thing? Like 3 steps ahead. Then he's going to say, why don't you start anticipating the 3 steps ahead?
Okay.
Like,
Going ahead and getting the suture loaded.
right. If again, this takes knowing the case. If you know he's getting to the point, we saw a video on it, right? That takes time. But in the beginning, you're just listening and getting what he needs. Over time, you're going to get better anticipating by knowing the case. That takes time. But when it gets really quick, just listen, right? Listen. If you don't know where it is, hemostat coming your way, doctor, and come back, look around. But that's why it's important to have things where you're comfortable with.
Okay.
And back here, your towel roll is really important because if this starts getting like,
Yeah.
can you imagine that final count? You're like,
Oh, God. Right.
it's going to be a hot mess, right? I'm sorry, I messed all this up for you. What time is it, guys?
Yeah. 11:30.
Okay, you got time. You just put gloves on?
Oh, what's the other?
No, that's fine. It's perfect. I don't want you
I
scratch.
was trying to do it.
I want you just, it's going through the motions. I want you to, at least be a part of it.
Can I fix it a little bit?
We're going to start from scratch. We're going to pull this out. And I want everyone to try, but, obviously time is an issue. We're going to constantly do this over and over, muscle memory, get you in a scenario, and just take a deep breath, right? And try. I'm just going to try to frazzle you eventually.
Do you want someone else to assist then?
Yeah. Want to take a break? Who wants to assist?
Haley, get in there. Haley loves working with me.
It is. It's a passion of mine.
Oh, she doesn't. She needs it.
Are you ready?
I'm scrubbed.
You have tie and passers?
I don't have a final one.
Yeah, you get one ready. This is all garbage. Back here. Need those. So I've seen this case a little bit, so you'd start anticipating, let's see if you can get those right. All right, local. Injection, local back. 10 blade. We did the timeout. Do you see this?
Yeah, I know. I gotta fix it.
What would be no? Or were you just going to put it down? Is that how you let it?
I don't remember how to do that actually.
You don't know. It's called a one cap technique. You should never use 2 hands because you can just stab yourself.
Uh-huh.
You're supposed to come in here just like that, right? You go up against them. It's kind of a one scoop.
Gotcha.
You should never.
Do I close it?
Yeah, it's once it's like that, you can just go in there like that. But get used to not taking it off, just kind of taking the cap off. But when you're done, you just want like,
Yeah.
and it's contaminated
I
now.
was trying to put it
I hear you. My dear, I'm just pointing it out. There you go.
in. Okay.
10 blade? Good. 2 heads with teeth. Incision. Blade down. Can I have Wheatlanders? Good. That's good. Army, Navy. There you go. Perfect. Penrose drain on a hemostat with I need also a right angle clamp or right angle. The Penrose drain on a hemostat. Coming your way, doc.
Oh, you're right now.
Doctor. You're not on the doc term yet. Good. Right angle. Or DeBakey, I mean. So you're trying to load these up, kind of load them up like that because that's what they're doing. They're just trying to push it through somewhere. And you guys know about this. They're trying to establish the spermatic cord, the best deference, and something else. Hemostat.
Important things.
Okay. A little big, but. Can I have a tie and a passer, DeBakey? Scissors, curved mayo to the assist. Shooters.
I do both.
Good. Leave a tie. Do it again. Get a free tie this time, or you got it? That's all right. I'll take that. The bakey. That's terrible. Got that. Hemostat. Hemostat. Hold that. Take that out. Throw it down. Coker. It's the right angle. Oh, it's like a lefty or something. Take that out with one hand. Yep. 10 blade. Do you have a suture? Can I get a suture over there? Oh,
Am I just gonna use this one?
no, it's too small.
Okay.
So make sure these sutures are in your suture box. So put that in one. Don't use your hand suture or needle driver. Just throw it right there. Blade down.
Okay. Put this one right here.
See where it says one? So watch. Does anyone not know where they put their sutures? So go ahead and lay that into one.
Just lay it there.
I'll show you. Yeah. So you want to put that right into there. Okay. Okay. And then if you're done with it, just cut the tip. Say, doctor, are you going to use the suture anymore? No. You just cut this off right now.
Okay.
Okay. So now you just keep going, right? 1, 2. So when it's counting, it's easier to count. 1,
That makes
2, 3. That's what that's designed for. Put your
I just thought it was there for a little bit.
yeah. Load that suture up, please. Suture.
I did it wrong.
No worries. So I know it's kind of coming out of the angle here, but you want to make sure that tip is facing my chest, right? The best you can. Now watch it. See how this is this? So it needs to be coming this way because that's how I'm going to use it.
Did I load it wrong though?
Perfect.
Okay.
To the left, I'm a right-handed. Now if I was left-handed, I would load it the other way, right? And then you would pass it with your left hand, right? Gotcha, right? That way. But since I'm right-handed. But what I want to see is if she was the doctor, right? I would go, see how that tip is facing the doctor's chest?
Mm-hmm.
I'm coming in just like that.
Okay.
You came in like this. Makes sense.
It makes sense. I'm probably doing it, but just-
You just did.
I'm very good.
No. I know you. It's okay. So start just like that,
Okay.
and then come into my hand, right? There you go. That's how I'm going to be using it.
Oh, so why do I have that little twisty thing that she teaches me?
I have no idea twisty thing. What are you talking about?
You're talking about the twist.
Holding on to the remaining of the suture.
So
That's what I was trying to do.
that twisty thing?
With your hand. You twist the needle cord.
Did I showed you a twisty thing?
No.
Oh,
No.
I'm just trying to
That's
understand.
just how I learned it, so that's why.
It's not a big deal as long
That's
as
why I'm trying to.
if you start here, that's fine. As long as it's coming towards me, I'm okay with that.
I'm just figuring out how I did that wrong.
No worries, no worries. And then the other question was, I forget now. Here, give it to me.
Okay. So you just need it like.
Yeah, it's fine. We'll try to give it how we're going to use it, right? Add some with teeth. Curved mayo, because that other ones suck. Cut that. Reload that up, please. It's hard, ain't it?
A little bit.
Hmm.
Okay.
And I'm going slow too. So. So if you're done, here's another thing. If you're done with that blade, do you think that's important? Just get it back in your back table. Yeah. Get all these off. Put it in your back table. We're already in here, right? We're not going to, unless they ask for it again, at that initial incision, when you're done, just put it in the back table. Because what's going to happen is you're going to go like that by accident, and it's just sticking out of your arm, right? All right, let's do it again. Good. Teeth.
To work on my left hand dexterity. Just this one?
Yep. Got that one. All right, good. What time is it? Anyone else want to try? You did fine. Yep. So it's organized chaos. Delaney, what time is it?
22 noon.
All right, we'll stop. Let's break this down here, and then we can do the relay if we have time.